Okay, good evening, everyone. Hi there. Welcome to our Scrivas Town Hall webinar. Our topic today is, my kids are back in school, now what? It's a great question. We've all been waiting for this moment since March for our kids to go back. They're back, and now we need to know the protocol and everything that is in place. Hi there, I am your host, Cynthia Demas. We have a panel of experts joining us tonight. And we encourage you to ask questions throughout the event. There's a Q&A chat section at the bottom. So as soon as you think of a question, just put it there. Let me introduce you to our panel tonight. First, we have Dr. Fernando Mendoza. He is a leading board certified doctor in pediatrics and pediatric emergency medicine. He is the founder and head of Scrivas, which is a COVID-19 screening and contact tracing company for schools, businesses, and healthcare facilities. Contact tracing, what is that and why is it so important? We're going to get all into that. Also joining us tonight is Dr. Stephanie DeChurch, a board certified pediatrician. And this year she's developed a reopening program for a lot of schools in Miami-Dade and Broward counties. And we also have Dr. Michelle Fernandez, a licensed psychologist who specializes in children, adolescents, and families. Her South Miami office focuses on young people with anxiety, depression, behavioral issues. She has her counseling psychology PhD from the University of Miami. Again, feel free to ask questions as we go. And let's get started right away. Panelists, thank you for being here tonight. And Dr. Mendoza, we'll start with you. What is contact tracing?
Well, thank you, Cynthia, and welcome everybody. So it's a great question. So, what is contact tracing? I mean, in the setting we're talking about schools and businesses, contact tracing is a process by which a highly trained specialist identifies students and faculty who have either been symptomatic, exposed, or even positive for COVID. And this process involves a real person, this highly trained individual, reaching out through a phone call or email, but most likely phone calls to the faculty or the parent of the student, and getting a real detailed account of the symptoms and exposures going on with the student. In the context of the schools that Scrivas has helped to reopen, the information we gather includes when and where the students have been potentially exposed, which classrooms they've been in, which athletic programs they participate in, and if there were any other school contacts outside of the school setting, that they may be exposed to. The information is uploaded to a live, real-time, HIPAA-secure dashboard, really visible only to the authorized school administrators allowed, so the administrators keep track of any potential outbreaks or hotspots. And more importantly, what contact tracing does in the setting of the school or any educational institution is that it helps determine when and if the student can come back to school safely in person. This is all done in coordination with the school's COVID policy and procedures, which in most cases are under the direction of a medical director. And in this case, we partnered with Dr. DeChurch on several occasions to provide that guidance to several schools. But we will work with the school's inherent health advisory committee if they have one. So that's basically in a nutshell what contact tracing is.
Okay, I know we have a lot more questions about contact tracing. We're going to get to all of them, but next I want to introduce our next panelist. That is Dr. DeChurch, who Dr. Mendoza just mentioned. They do work together quite a bit. And Dr. DeChurch, we talked about you putting some protocols in place for schools. What did you do and what does that look like?
Thank you, Cynthia. Well, this past year, I opened a new boutique pediatric practice called D Pediatrics. And it was really founded on a focus on personal attention, really giving families what they wanted and without the wait times. With that same focus, I started the COVID-19 reopening program, working very closely with Dr. Mendoza with his contact tracing. We follow all American Academy of Pediatrics guidelines and Center for Disease Control guidelines. And we did this in consultation with a group of doctors of infectious disease, immunology, pulmonology, emergency medicine. And we really went to the schools and dug in deep and were able to implement a program that was comprehensive. It provided education on symptoms, protocols, proper prevention of COVID-19 in the schools. It also looked at air ventilation and making the air safer and protecting what we call surface protection. And we also identified the high-risk individuals in the schools, and also gave the faculty and the families some things to look for, signs of mental illness, such as anxiety and depression, which we're seeing a lot more of.
Okay, and with that anxiety and depression topic, we will go right into Dr. Fernandez. Anxiety and depression, we're not just talking about the parents here, the kids are dealing with a lot. So what are you seeing and what should parents know?
Yeah, certainly with all the disruptions in our everyday life, kids have been really feeling it. Suddenly parents are home, kids obviously unable to go to school for quite a bit of time. What's interesting is that anxiety and depression show up differently across different developmental stages. When we talk about the little ones, preschoolers, often what we'll find is clinging behavior. You know, you might find that your child is sneaking into bed with you more days than not. We might see some regression in their milestones. So suddenly they're having accidents after already having been potty trained for a year. We might also see some school refusal now that doors have opened back up. They might feel a little bit uncomfortable about heading back. They've gotten comfortable in the rhythm of being at home. So we might get a couple tantrums heading out the door. For the older kids, elementary, middle school age, you know, these children tend to be a little bit more aware of the world around them, expect lots of questions from them, seeking excessive reassurance. You know, is it safe? Is it going to be okay? We might see some irritability, right? The tantrums look a little different when they're older. Because of the school demands, we might, you know, some kids might complain of having a harder time focusing on their homework, for example. Certainly if there's a decline in academic achievement, that's something we want to keep an eye out for. That's a red flag. The adolescence is a whole other, you know, brings about a whole other set of challenges. A lot of them are experiencing obviously a whole lot of anxiety, but also grief. You know, those high school seniors that weren't able to walk across the stage are feeling a lot of loss. So certainly things that as parents, we have to keep an eye out for.
Okay, very good. Thank you for that. I do want to get back to a lot of topics here, but let's go back, Dr. Mendoza, and talk a little bit more about contact tracing and how that works. I know that you're working with a number of schools and you take in a lot of information. And if somebody was exposed to somebody with COVID, you are basically on the phone with them daily, handling the situation. Tell me a little bit about the schools that you've been able to work with, the results that you've seen. I mean, is this new protocol, is it working? What are we seeing here?
Well, we know it works because we've opened several schools and opened them already, and all we're seeing, and we're tracking some students with symptoms and exposures. We're not seeing any outbreaks in those schools. Actually, to date, of the schools we're working with, we haven't seen anybody who's acquired or contracted COVID within the school setting. So we know it works. And you really have to work very closely with the school to ensure that the proper protocols are in place, the mask wearing, the social distancing in the classroom, identifying which faculty should be teaching virtually and which ones should be, can be teaching in person. But adhering to those protocols, having a very engaged and invested parent population really helps, because you want the parents and the students, first and foremost, to be educated on the symptoms and to be honest with the symptoms. Having an engaged and invested parent group allows the students to really identify themselves, self-identify, self-report in, whether it's a phone call into the school nurse, an email into the administrator that's tracking anybody who's ill, or using the mobile screening app. You want to make sure you're being honest with yourself so that you're not exposing or putting any other students at risk. All the parents who are sending their kids to school, some may not choose to send their kids to school for various reasons, but the ones that do want to ensure that they're following the right protocol so they can keep the schools open going into the next few months.
And how's it going? What are parents doing right? What are parents doing wrong?
Well, the right thing is the parents are reporting the kids who have symptoms. And, you know, right now, a fever and cold symptoms really is COVID until proven otherwise in pediatrics. Now, you know, working in the pediatric ER, we see lots of exposures to COVID, and a lot of parents are concerned for COVID. And most of the time, it's not. Our infection rates and our positivity rates right now in Dade County and Broward County are pretty low. But you don't want to discount any symptoms and say, oh, it's just allergies or it's just the sniffles. Really want to take that seriously until you get the clearance from your pediatrician or other healthcare professional to make sure it's not COVID, so you're not putting other people at risk.
Okay, and we are talking about numbers, and everyone's talking about the wave. We're getting ready for the wave. It's going to increase. We're going to see it in November. The hospitals are getting ready. What is this true? Is this going to happen? Dr. DeChurch, what are we looking at here?
I mean, right now, we have seen it kind of go up and down a little bit. But overall, it's staying steadily under 5% on our 14-day average. So that's a really good thing. But I really wanted to stress the importance of something that Dr. Mendoza just said, and that is that parents keep their children home even if they have mild symptoms, okay? And I'm gonna go over the symptoms of COVID. COVID can be fever, cough, even a runny nose, any new symptom of these things, vomiting, diarrhea, muscle aches, sore throat, shortness of breath. Any of those symptoms could possibly be COVID. And in kids, more so than in adults, when I say kids, 20 and under, 50%, half of the kids that come into the pediatric office have co-infections. So it's really important that if you go to your pediatrician and you find that your child has something else, like a sinus infection or a strep throat, they could also have COVID, because COVID 50% of the time has another infection with it. So I just want parents to know that it's very important if they go in to see their pediatrician that they do get tested if their child has any of the COVID-19 symptoms. And remember, in children, it's often mild. So that's, I think, a point I really wanted to make to our parents out there today.
Okay, and it is, yeah, go ahead, Dr. Mendoza.
Yeah, sorry, I want to piggyback off of Dr. DeChurch. We're not out of the woods yet. We have a long way to go. We have winter, we have holidays, we have a lot of, schools opening back up. Just because policy dictates that we're opening up doesn't mean that we need to relax our protocols or let our guard down. For sure, keep an eye on that. And that's what's going to ensure that we can keep our society, our schools, really is what this talk is about. Our schools opened and going on, which is what we want for our kids. We want them to have that academic enrichment and the social engagement.
And you mentioned the holidays. Go ahead and weigh in on that, Dr. DeChurch.
Especially with the holidays, where we see COVID spread is usually with friends, where we have our guard down. We're around people we know, we feel relaxed, or around extended family. That's really where we see COVID. In the schools, we have not had one case, as Dr. Mendoza said, not one case of transmission on campus. However, we do have COVID positive cases, and we're expecting to continue to see COVID positive cases, but we're seeing those happen outside of the schools. And that's really where, during the holidays, be careful. See your friends, but wear a mask. See your friends, but social distance. Go outside. We know transmission rates are much lower outside than inside in an enclosed space. So those are some tips that you can keep in mind during the holidays.
Okay. And Dr. Fernandez, everyone, the holidays are about cheer and happiness and family. It's a lot different this year. How do you manage that? And how do you handle that for your kids who've already dealt with so much for, already 9 months or whatever it's been? How do you say, okay, well, Christmas is going to be a little different. Grandpa and grandma aren't coming this year. How do you prepare them mentally for that?
Yeah, I think one of the first most important steps to take is just honest communication with children. I find that often parents are afraid to tell the kids the truth. It's okay. It's okay for them to know. Just be sure to say it in a way that they can understand, a way that they can digest. If grandma and grandpa are coming down and, we know that granddad is, has a history of medical surgeries and what have you, it's important that the kids know so that they can be part of the solution. They can be empowered to make decisions to keep themselves safe, to help keep granddad safe. Involving them in the process is far more beneficial than trying to kind of conceal the truth from them. When we conceal the truth, children become suspicious. And when that breakdown of trust happens, it just really erodes the quality of the relationship.
And you talk about being honest, right? But let's talk about your kids watching the news or getting on social media. And then, we're about to have an election and that is weighing on kids also. We're not talking politics today, though. Don't worry about that. What do you let your kids get exposed to? It's all over the place.
Yeah, we live in a society where we have information overload, and sometimes we can't tell fact from fiction. And for children who live a life of fantasy, it's even more difficult for them. So, boundaries are a good idea. Setting time limits on how much they can watch, what they do have access to watch. And then again, going back to communication. So if they caught the latest headline, ask them, what did you think about that? What does that mean to you? and use it to set the stage for further dialogue. Ultimately, children will listen most to their parents.
Hopefully so. Let's talk a little bit about the difference between the flu, because it's flu season too, and COVID. Dr. Mendoza, Dr. Church, Dr. DeChurch.
Sure, yes.
Go ahead.
So we are actually very concerned about the flu this season because of COVID-19. We're worried about the co-infection, as we were talking about earlier. So it's very important for everyone to get a flu vaccine. Anyone 6 months and older can get their flu vaccine. And the flu vaccines have been pretty popular this year. A lot of people that say, I've never gotten my flu vaccine, in past years have gotten their flu vaccine this year, which is fantastic to see. But the flu in general, we see usually more achiness throughout the body, but we also see similar symptoms in COVID in the sense that you can have vomiting and diarrhea. You can have the cough and congestion. Usually with COVID, we've seen in kids less severe symptoms than we typically see with the flu. But we do have that concern with co-infections. So when we are testing our kids for COVID, if they are having symptoms that overlap, we're also testing for flu.
Yeah,
And
I'll agree. I mean, I think that it's going to be really hard to distinguish one from the other this season. I'll also point out, that Dr. Church mentioned that 50% of kids, earlier she talked about the symptomology of COVID, and at least half the kids don't even have symptoms of COVID. They're asymptomatic. So we know that. We talk about 50% being co-infected. Half of them, if you divide that even further, don't even have symptoms. Another thing we wanted to point out is we're entering the flu season now, and we had a wave in July and early August. We're expecting some more infections, some more COVID resurgence. We do have the snowbirds that are going to come down to Florida. So there's going to be a lot of cross-contamination and infections there. We're really watching out for that at the hospital level. But the other thing we want to watch out for is if your child, especially 8, 10 years old, or even teenagers, have been exposed to COVID, had a positive history of exposure or a positive COVID test, been asymptomatic, there's a syndrome out there called multi-system inflammatory syndrome in children. It's pretty rare, but it's an overall inflammatory syndrome where kids will get a fever, a rash, maybe belly pain, and I would ignore those symptoms. It's a rare symptom. It's an overall inflammation in pediatric patients. We're seeing that about 4 to 8 weeks, about 1 to 2 months after a COVID infection, or even a known COVID exposure with no symptoms. We'll see that in kids. We are seeing that in our emergency rooms. It can be very serious, although it's very rare. Less than 0.5% of kids who get COVID are getting it, but it can be really serious. We want to watch out for that over the next coming months.
okay, we got a couple questions coming in, guys. We have one viewer who's asking, if a classroom is quarantined because a child in the class tests positive for COVID, should the siblings of the quarantined classmates also stay home? Did you get that?
Yeah, and I think I'll answer the first part of that question. That's what contact tracing does. We'll get on the phone with that when we're in the school. We'll get on the phone with that parent, talk about the sibling, the one who is infected or is positive. Do they share rooms? Are they in the same sporting activities? I mean, if they don't share rooms and separate bathrooms and actually separate sleeping arrangements, that may kind of determine what needs to happen with that student. But Dr. DeChurch and I, we deal with this on a daily basis when it comes to the schools and the teenagers, which are sharing households.
Okay. Another question we have from concerned parent Jeff. With Halloween next week and it typically being outside, do you think it's safe to trick or treat? Let's talk about Halloween, folks. Where do we start?
Absolutely. Well, we know COVID-19 is preventable. And the way you can prevent it is by wearing a mask. Okay, make sure when you're wearing a mask that you cover the nose, the mouth, and the chin. Okay, that's very important. And it should have a nice snug fit. I see a lot of kids and teachers I've seen in the past where their masks kind of fall down over the nose, or they kind of hang them off their ear. You do want to have your child with a mask on. You do want to social distance, okay? That doesn't mean they can't reach out for candy. You can be about 2 arm lengths away is 6 feet, and outside, it's not quite as bad as being in an indoor space. And then hygiene. Make sure before you touch your eyes, your nose, or your mouth that you wash your hands. Really important with young children that they don't use too much hand sanitizer. We have seen an increase in poison control calls for kids actually ingesting too much hand sanitizer. So it's better when you can, soap and water or a wipey. But keep those hands clean. And I think that if you do those things, that you can safely go out and still enjoy the holiday.
But a Halloween mask is not a mask.
No, unless
No.
it's like this.
You know,
Okay.
we take out flashlights when we're walking the streets on Halloween. You know, take out the bottle of hand sanitizer, sparingly and appropriately, and that could be just as useful. There might be some new techniques this year. I think either using throwing candy or water balloon launchers or something. But if you're on the sidewalk, you can trick or treat. The kids really don't need that much. They don't need to get that much candy. We know that. So that's a whole sugar content discussion. But, just seeing the sights and seeing the kids outside, be conscious of your distance with the other kids.
I've heard the PVC pipe also. People are going to shoot the candy down the PVC pipe. So that's a good one there too. Okay. A lot of people are saying, I hear this a lot after they have had COVID. Oh, I have the antibodies, so I'm good for 3 months. True, not true? What is this all about?
Yeah, we don't know. The jury's still out on this one. I mean, we hope it's true, but we don't know. There are definitely documented cases of COVID reinfection. That is for sure. So we don't know what the level of antibody response and protection you have. Just because you had COVID a few months ago, do not assume you're immune to it. Okay.
And let's get Dr. Fernandez in to talk about signs of anxiety. I mean, almost everyone's child's had a birthday already through COVID. Now we're going to do a COVID Halloween and a COVID Thanksgiving and a COVID Christmas. What do you look for with your kids' mental health situation, Dr. Fernandez? And when do you realize you need professional help for them?
Yeah, so, certainly given all the changes, we expect anxiety. Anxiety is meant to be adaptive and warn us when something's not safe. So if we're feeling anxiety because we are around folks who might put our lives at risk or get us sick, I mean, sure, we're going to be anxious. But there is a line, and that line is drawn when we think about how is it impairing our daily functioning and how persistent are the symptoms. So if the child just headed back to school and is having a couple of sleepless nights, that's okay. We'll keep an eye. But if 2 weeks go by and, nights are still restless, child can't get up out of bed, then, that's a red flag to keep an eye out for. So certainly just to kind of list them off, sleep disturbances are a telltale sign of something going on, change in appetite, taking a look at academic achievement. If suddenly we start seeing those grades slip, that's also something to take note. Certainly with the older kids, when helplessness and hopelessness starts to set in, again, a lot of my high school students, that path towards college applications that used to be really well worn for them, they now, are rescheduling SATs, and a little bit of hopelessness is setting in. Do listen to your kids if they're telling you that they are not feeling well, that they are tossing and turning, having racing thoughts, worried about the future. Be careful to not quickly dismiss with reassurance. I know as parents, we want to tell them everything's going to be all right, and we hope it will be, but it is important for us to listen to our kids, validate that what they're feeling is okay, and that we can come up with a plan to help them help themselves and to help us all move forward.
All right, great advice. I have a couple more questions that our viewers are writing in. One question is, our kids really want to see their grandparents on Thanksgiving. Is it safe if we eat outside?
It is safe if you eat outside, but still keep in mind if there is someone that is more vulnerable, someone that's elderly or has a high risk condition or has both, then you still want to protect that person. So mask wearing when you are a little closer together and social distancing still. And it is a good conversation to have with your kids before the dinner so that they understand that there are certain things that they want to do to reduce risk.
And something you all said earlier that's worth reiterating, if you follow the rules, it works. So if you wash your hands and you keep a mask on and you social distance, it works. I interview doctors all day long who are with COVID patients all day long, And I've done it for months, and not one of the doctors I've interviewed has gotten COVID, because if you follow the rules, it works. So we can't stress that enough. I got another question for you guys. What are you seeing regarding the latest research with regards to child to adult transmission? Dr. Mendoza?
Yeah, I mean, there's research coming out all the time, and the most recent, I know there's been some recent studies coming out regarding daycare really not being a kind of focus for transmission among kids, among each other, and we know that kids tend not to be the ones who are transmitting it in the household. So that some of that research is still pending, and this is really huge population data. It's going to take a few weeks and months to really kind of collate and bring together. So the jury's still out, but we tend to think that kids aren't, especially the young kids, so the daycare, the school age children are the ones that are not really being the source of transmission. Now, teenagers. We know teenagers are involved in a lot of super spreader events. Teenagers, especially at this, 8 or 9 months into COVID, they have a very high risk tolerance. They think they're invulnerable. It can't happen to me. They're not really getting that sick when it comes to COVID, unless they're obese or have another underlying medical condition. Those kids can get pretty sick with the acute COVID condition. So teenagers can be a source of spreading. So be careful with that. Going out to parties or get-togethers. They want to get together with their friends. They're hugely social creatures. We know that. All parents were teenagers at one point, and we know that those kids really can get out there. And you want to be honest with that conversation and really lay out what kind of the rules are for engagement with their peers.
Okay. And we want to know a little bit more about kids getting tested, when they should get tested, and how the testing is different from when adults get tested. Is it true that when adults are tested, it goes quite high up the nose, and with kids, it doesn't have to go as high? Is that true?
What it is there are different types of tests. So what you're describing there is not considered an adult versus a child test. It's actually a PCR test. So we do PCR tests all the time in children. And it's really what in medicine we've considered our gold standard test. So we are really getting to the area where we're most likely to get the highest amount of viral load. So that one, what it is, it's the distance between the ear and the mouth, and you go about halfway. So yes, you do use a swab up the nose on both sides, and halfway between is where you get into what we call nasopharynx. So that is our gold standard test still. We do have some rapid tests that are out there, and some of them are pretty high, what we call sensitivity, meaning they're most likely to pick up cases. And they have very high specificity, meaning that if you are positive, then you definitely have that COVID-19 disease. But they're not as highly sensitive. They're not as likely to pick it up as it is with a PCR. So when we have a questionable case, then our gold standard still is to do our PCR testing. As far as when you do testing, anytime you have symptoms, any new symptom that we had talked about earlier, you would get tested. If you've had an exposure to someone who either has COVID-19 or is suspected of having COVID-19, if you were with that person 2 days before they started with symptoms, or they tested positive, then, or later than that time, then you should also be getting a COVID-19 test and quarantine. Now we do have you wait after your exposure a period of time, because if you test too early after an exposure, you might get what we call a false negative test, where you'll come back with a negative test, but actually you're still incubating the virus. So that's one of the things that Scrivas does with their contact tracing, is they let you know when you need to actually get your test based on when your exposure was.
Okay, I got another question for you, actually a few more coming in here. There's a lot of talk in California and Illinois about high school sports. Should kids be allowed to play high school sports? Is it worth the risk? Let's have Dr. Mendoza to Church weigh in about the risk, and then Dr. Fernandez weigh in about the mental well-being of kids who want to get out there and play sports. So Dr. Mendoza?
Well, there's certainly going to be different levels of risk depending on the kind of sport. So we know in Florida, Football has been pushed back, but a lot of schools are playing. It's an outdoor sport. There's obviously a lot of contact in football. Indoor girls volleyball was pushed back, and that's going to be starting up again. So indoor sports tend to have a little bit higher risk because of the air circulation and the level of contact. And really, that risk tolerance, most of the schools and most of the parents or most of the schools are looking at, and school districts are looking at the percentage of positivity rate in that county to determine when they will actually let the schools start the activity again. We know there's a lot of club and travel teams that don't really follow the school district guidelines. So that's really an individual, risk level determination you have to have as a parent. Do you have someone at home who's high risk? Is it something that you can tolerate that risk because you don't have exposure to really elderly people, or your kids don't have any underlying medical conditions? So a little bit of individual risk level, risk tolerance, and following guidelines for the school districts and the organizations that your sports are following kind of depends on the local positivity rates.
Okay. And Dr. Fernandez?
Exercise is a wonderful way of coping. So we definitely want our kids out there doing whatever form of exercise they can. The tricky thing about athletes is that they often very much identify as being just that, as being athletes. So when that is taken from them or is disrupted in any way, particularly for adolescents where they're really in this search for self, it can be really quite stressful. So what I often will encourage is, how else can you be connected to your identity as an athlete and not be on the field? So I actually, even pre-COVID, athletes who have injuries and can no longer play, it's really a huge blow to their sense of self. So creativity here will be a really important tool to be able to help navigate through these variety of different types of losses that kids are experiencing.
Okay. And another question we have coming in here says, I've kept my 2-year-old out of daycare during COVID. Although the class sizes have been kept smaller, is it safer to keep my child at home instead of daycare, especially since kids her age are not able to keep on a mask?
So in general, the younger children have done pretty well. Really, you need to do exactly what Dr. Mendoza was saying earlier. You have to assess the risk status of other people in the household, who that child is going to be exposed to. If you don't have any high-risk individuals, if your 2-year-old is not at high risk for any medical condition, then really we are letting our families know that it is okay to go to school. Now, I would check to see if they've done what we call de-densification, meaning they don't have as many kids playing together. We're trying to keep smaller bubbles like we do with our friends and family at home. So that's something to talk about. And what they're doing for air ventilation and surface protection in any of the schools is important as well.
You talked about that at the beginning of the conversation, Dr. DeChurch, air ventilation. Did the little zappers in there really work that clean the air? Is that really effective?
Yes. We actually had a great advisor on the air and surface protection. And there are things that you can put in your air conditioning systems. One of the top ones are ionizers, and they actually kill viruses, molds, mildews, bacteria. They actually purify our air. So those are great. There are also things that the American Academy of Pediatrics recommends as well, like UVC lights. You do have to have a certain wavelength on those. So they're important to make sure that you're getting advice from an expert in that area that follows the American Academy of Pediatrics guidelines on that. And then for surface protection, we like to use things that are safe for kids. So we do follow American Academy of Pediatrics guidelines on that as well, with the EPA approved for kids. So there's an actual section in the EPA where they have certain disinfectants for surface protection that are much safer for kids than some of the others.
Okay. We have another question for you here from one of our viewers. It says, what are the post-Thanksgiving plans with respect to in-school versus virtual? Are schools giving this any thoughts? Or are they just probably too afraid to talk about it because they don't want to hear what parents have to say? What's going on with post-Thanksgiving plans? Any discussion on that?
I think you're really have to have the discussion with your school, and either through your PTA or whatever outlet you have, because we shouldn't be afraid to talk about it with the school, and the school should not be afraid to talk about it with the parents. They really have to be on top of this. And like, we're really talking here about school, getting back to school, which is the topic of this webinar. Having parents that are invested, engaged in what's happening at the school level, whether it's air purification, de-densification, contact tracing. What do you do when someone, because we're going to have positive cases in the community. That's going to be around with us for a long time, for at least through 2020 and 2021, at least part of 2021, we're going to definitely have to deal with this. So, post Thanksgiving, if there's a lot of contact, and we know we're about 2 weeks behind any large mass gatherings and exposures before you start seeing the community increase in positive COVID cases. So have this discussion with your school administrators. They should be reaching out to the parents on a regular basis, giving updates on what's happening with regards to COVID and COVID policy at your school.
Well, what about, how do you handle that with the contact tracing and people are going to get on planes and they are going to fly up and they're going to fly back? Is part of what you do keeping track of who got on a plane?
Yeah, I mean, certainly travel is one of the things that we look out for, and it really ends up becoming a school-based policy. I mean, most schools will follow the CDC guidelines, but there may be state or local school board recommendations that or county recommendations that the schools have to follow. So this is, it's been left up really to the counties and the school districts and the individual schools to set the policy. So there may be some school or school districts who decide anybody traveling to a hotspot. We knew way back when at the beginning, New York was a hotspot, then Florida was a hotspot. So if a new hotspot arises in some part of the country or internationally or nationally, and there's travel to and from, that's certainly one of the questions that we ask on a regular basis, and that students will be screened in for at the schools that we're involved with. They'll screen in for, have you traveled recently within the last 3 to 5 days?
Okay.
And also concerned about the type of travel. If someone took their personal car or, a private way of transportation, that's much less risky than doing public transportation. So getting on an airplane, and even though air ventilation they have, worked on that for airplanes, you are still very close to other people. So the Center for Disease Control does look at air travel as a very high risk activity. So even if you're not going to an area that's a hotspot, you still, it is still recommended to quarantine whenever you come home from commercial travel.
Let's talk about ethical obligation of professionals or anybody. So if you have COVID, how far back do you have to go in the timeline to notify people?
2 days.
Just 2 days.
2 days. Yes.
So if I realize today I have COVID, I just have to go back a couple of days and tell those people who I was around because people couldn't catch it from me before then?
2 days from the time you've either developed symptoms, Cynthia, or 2 days from the time that if you did not have symptoms, that you got a COVID positive test.
Okay. So if go ahead.
I was going to say, so that's when Scrivas contact traces, that they ask the students who were they around those 2 days prior. So that, or if it's not Scrivas Department of Health, although we love Scrivas.
Okay. Another question that came in here, are the local schools in communication regarding siblings and possible exposure? Do you know about that?
What was the question, Cynthia?
Are the local schools in communication regarding siblings and possible exposure? I guess if the kids go to different schools.
Well, yeah, our school, with the schools we're working with, yes, we'll figure out, we'll let the parents know of which siblings are, and it's up to that parent. If there's different siblings at different schools, each parent, for the most part, has to sign a contract or at least an agreement with the school that, hey, we're going to report anybody who has exposure or symptoms. All the schools are screening in now, whether it's through an app or through just, kind of a reporting in. So, once the parent, that's really a parental responsibility. It's a contract or an agreement they have with each individual school, whether it's a public or private school, to let the school know, hey, my kid can't go to school because the sibling is now positive for COVID.
Okay. We have another question here for you. How safe will it be for our kids to receive the COVID vaccine as soon as it is made available? Should I wait a bit before having it administered to my child to make sure there are no negative or harmful side effects? And how long would a bit be? Thoughts on that?
Yeah, well, I mean, we don't know about the vaccine yet, so it's a lot to speculate. I mean, I think
Mhm.
that we have to wait for the data to come out. For the FDA is going to approve the vaccines when they're ready for public distribution. I mean, we know that for sure when the vaccines that do, and they're going to probably be several different vaccines that come out over the course of the next year or so. Who gets it first? Probably the frontline healthcare workers and first responders, high risk elderly. Children will probably not be at the front of the line to get those vaccines. There may be vaccines that are designed for elderly and some for younger. So I think that's a great question, but we don't know the answer to any of that yet because we don't have a vaccine yet.
Yeah, and they're
So
to do trials now in children. So those are actually in the works now. But we really don't recommend vaccines as far as, Center for Disease Control and American Academy of Pediatrics until we really know that something is safe for children. So once we really look at the safety profile, that's when and once we see that it is safe in children, that's when we can go out and recommend a vaccine.
Okay. And what have we learned since this really started in March? Because at the beginning, everyone was spraying their plastic bags and wiping them down and leaving them outside, and then taking a glove and putting the food in. And it seemed like we don't have to do that anymore. What have we learned as we learn more about COVID and how to be safe?
Well, what it is those are called fomites. So whenever you're cleaning the bags and you're cleaning all the things that come into your house, you're reducing the risk of having the transfer of the virus on a product or your animal or things like that. We know that is not the main source of COVID. Somebody would have to sneeze or cough pretty hard to get enough of the virus on that for it to live on that surface. However, when they've done studies on pharmacy floors, they found 100% COVID when they go in and they take samplings of the floors. So I don't do anything without washing my hands. If I'm going to touch my eyes, my nose, or my mouth, I still wash my hands as far as fomites go. The main source is respiratory droplets. So it's when you're having that close contact conversation for more than 15 or 20 minutes. It's usually with someone someone you feel very comfortable with. That's how you usually get COVID. And that's why we say it's so preventable, because if we keep that in mind, keep those masks on, except for when when you're in your bubble, your home, keep your masks on during the rest of the time, and it really is preventable.
Okay, and holidays around the corner, so you get a mask for every holiday. We got Halloween, Thanksgiving, Christmas, Hanukkah, the whole thing. Let's talk about that, about the holidays and grandma and grandpa and our elderly loved ones. A lot of kids know now, oh, I can get it, but it's probably not going to be that bad. But if I pass it on to my grandpa, it could be fatal. So that weighs a lot on them. So Dr. Fernandez, kids don't want that responsibility. How do you handle that?
Yeah, it's tough. Certainly they carry a lot of guilt when they do find out that they may have been the cause of why another family member may have gotten sick. I think that we're all doing the best that we can. And I think, those of you that are here today, I mean, you're doing it, right? You're informing yourself. You are, I'm sure, taking notes and texting friends to stay informed. And information, being knowledgeable is what will allow you to make responsible choices. I think, guilt is a perfectly normal emotional experience. If the child feels guilty, validated, it's okay to feel bad. We know that you didn't mean to. What are we going to do about the guilt, right? I mean, I say this every day at the office. Feelings come without permission. It's what we do with them that really counts. So kind of focusing on that coping, modeling for your children what that looks like, living a balanced life. I've heard from patients, they almost feel guilty about wanting to celebrate things in the midst of, the headlines and all of the despair that we're around. But quality of life matters, and this thing isn't going away. So we need to find a way to continue, striving for balance and mental, emotional, and physical well-being.
Okay. And what else do people need to know? What other revelations have kind of come along in the recent, month or two? Dr. Mendoza, what else, what's a standout bit of information that you think people really need to know that you're kind of surprised a lot of people don't?
Well, I think the most scientific revelation is it's really confirmed that it's aerosolized. I mean, for a while we thought it was really heavy respiratory droplets that were kind of would fall easily to the ground, but now we're really looking at it. It's an aerosolized. In other words, the respiratory droplets can really get into these fine particles that can linger in the air. So I think that's kind of the revelation, even from the medical community, that, and that's why mask wearing is so important and hand washing is so important. So I mean, I think that I think we're and now the other revelation is that we're seeing, I think I was talking with some of my colleagues the other day, some of my medical colleagues, and we kind of all thought at the beginning, in pediatrics in March, April, this would be done by summertime. We were done by July, August. The revelation is, herd immunity by letting it spread through the community is not the answer. It is not the way to go. Oh, well, we know college campuses are, a lot of college towns are kind of ground zero now. There's a lot of, people going back to school, and there's a lot of, college kids on kind of the same young adult mentality of them and vulnerable. There's a lot of outbreaks in those small college towns. This is not going away anytime soon. These waves are going to be coming, kind of up and down in our communities for the time being. So the fact that, the revelation is it's not really going away right now. Herd immunity is not really an option when it comes to how do you protect your community. The way to prevent it is to do what we've been doing, no matter how uncomfortable or how annoying it is. Hand washing, mask wearing, social distancing, that works. And that when you let your guard down, and you don't do that, example, in some of these outbreaks you're seeing on college campuses, then those are the repercussions. So I think the fact that we're gonna be living through several smaller waves in the future, that it's aerosolized, really aerosolized, that was kind of the big standout in the last few months.
I would say to that, Dr. Mendoza, with it being aerosolized, we really want to stay out of enclosed spaces when we can, when we are having any kind of social events. So if we can get outdoors so we don't have that enclosed aerosolized space. The other thing is a lot of kids, their most common illness that we see when we look at risk is asthma. And our kids with asthma have done very well with COVID. But our concern is nebulizers, because whenever you put on a nebulizer and a child has COVID-19, you can aerosolize the virus throughout the house, or throughout the room. So it is important to speak to your pediatrician, have your pediatrician change your medications over to the little pumps, the little inhalers, versus using a nebulizer machine.
And I want also Dr. Fernandez to weigh in on the revelations that she's seen. But first, spell aerosolize. Spell that word for me.
AEROSOLIZED.
You got it.
Okay, I had it totally wrong. And define that for me again, because I think that's a new word for a lot of people, and I think that it's really important for us to understand what that means. Just to explain that a little bit more.
I think the analogy is like the old type hairspray, right? It was just anything really misty. And aerosolize is a droplet that stays suspended. It's small enough to stay suspended in the air for a while. So it's an aerosol.
Okay, so like a little like dust almost.
Yeah, I don't know if Dr. Church wants to say something, define it further.
Well, I was just going to say, I think what most people are familiar with are the nebulizer machines, the ones where the kids wear the little masks. I hardly know anybody in Miami that doesn't have one.
Right.
So that aerosolizes or nebulizes the medication. So the same type of thing, you can actually aerosolize the virus that way.
So one of the first things we did in the hospital setting, in the emergency room setting, is when we had kids or anybody suspected of COVID, or actually, now we're moving to everybody. When you need a nebulizer treatment, we typically would have put an aerosol on them, and it would kind of be in the room. Now we're switching over to the meter dose inhalers with the spacer for kids who are old enough, usually over a few years of age, 4 or 5 years of age, they can do it. And we know from a lot of past research that is just as effective as the aerosolized machines, as those nebulizers. The nebulizers are pretty easy because you pop them on and you go, but we're using the meter dose inhalers in the hospital setting to administer those medications to kids because we didn't want to have the risk of the COVID being really spread within the hospital.
And for kids that are younger than the ones that can do that on their own, what we do is we get the little masks that we seal it on their face, we hold it on the young children, and then we can go ahead and do the puffs. So they can do it as well.
Okay, makes sense. Back to our revelations, Dr. Fernandez, anything that's really standing out?
I mean, I think one of the things that the pandemic has punctuated is the importance that children have consistency and routine. It creates emotional stability for them. They can know what to predict while there's been a whole lot that has changed across the world, a lot of things have stayed the same. So highlighting those for kids has really helped with their adjustment. They might be wearing the same uniforms at school. Sure, now they're wearing masks and have to walk 6 feet apart, but same loafers and uniform shirt. That helps, kind of highlighting consistency, creating a daily routine, same bedtime, same wake up time, certainly on school days. It creates a rhythm. I kind of compare it to when we lull babies to sleep, kind of that back and forth. We do that too with the rhythm of the day, kind of keeping that structure in place is really critical for kids to feel emotionally safe.
Okay, and we have another question that came in from a viewer. Are there any concerns with kids wearing masks for so many hours while in school? And then also I'd add to that, and also playing sports with masks. Is there a carbon dioxide fear of something going on there, or what do we think?
No, I mean, there's really been no evidence of that, of retaining carbon dioxide. I mean, the masks are breathable. We know that surgeons, for example, for many, many years have been wearing masks in long surgeries, and they don't re-breathe carbon dioxide. So it really isn't a concern. Certainly, there's more of a concern in sports if you're actually being really aggressive, whether you're doing something near contact, the spitting and the kind of exhalation can really create a spread. I'll add to the revelation part, Cynthia, is like, I don't think we realize how much as a society, we all touched our faces and eyes and nose. I mean, all the time. I mean, that's something we really became very, very conscious of. And I don't think anybody in 2015 nailed it when they said, where would you be in 5 years? I don't think anybody got it right. So I think this is my biggest revelations is how much you touch your face or your kid, and where you'd be in 5 years. Who knows where we'll be in 2025?
Who knows? In the 50s and 60s, they wore gloves all the time. Maybe that'll become stylish again.
Yeah.
Maybe someone can come up with that. Let's talk about sports though, and kids playing with the mask on. Is that dangerous at all because you're breathing so heavy? And what about paper versus a cloth material?
Well, paper is not going to hold up too well with sweat and breathing. So I think, most of you see a lot of situations where people are wearing buffs, the pulling up the necks, or I know there's a couple of, companies, sporting goods companies like Nike and Under Armour and Reebok that have masks. Listen, it's really not going to hurt the kids, especially teenagers, to run around with masks. It can be hot, it can be uncomfortable. But if you're in close quarters, in close contact, it's probably not a bad idea to do that.
Okay.
I have another. We don't like it because of performance reasons, but it's not going to cause any physiologic, and we haven't seen any research come out of regarding that yet.
Okay. Another question that came across here: what are your recommendations regarding exposure to grandparents and in-school siblings to newborns? Let me read that again. What are your recommendations regarding exposure of grandparents and in-school siblings to newborns?
Well, newborns, regardless of COVID or not, I mean, especially with less than 2 months of age, I would be really careful exposing any siblings to newborns, just because in the pediatric ER world, and Dr. Church will confirm this, we get kind of really worked up about fevers in kids under 2 months, because it could be a whole host of things. So newborn, I mean, for sure, mask wearing around newborns, for sure, hand washing. That was pre-COVID anyways. So that's, even more heightened now. But we have seen newborns who are positive for COVID. They haven't gotten very sick or really that symptomatic, but you don't want to have a fever in a 1 month or 2 month old child. That's pretty, we have to do a whole host of other things in the emergency room, and it gets pretty invasive. So you want to really keep those siblings, washing hands, masks on, and not holding them too closely.
What is a standard incubation time for people with COVID? I mean, does it vary depending on the age, or do we see something like a standard for kids versus adults or the elderly?
They usually start developing symptoms 2 to 5 days after exposure. That is the typical time that they are most symptomatic.
And in most cases, when we see them in the emergency room, the patient typically knows, or the parent knows, I know where this came from. And it can typically identify a situation, whether it was a small gathering or kind of, they can almost always say, well, it was 4 days ago we were here and now we have this. I mean, I don't know if Dr. Church wants to elaborate on her, her experiences as well, but certainly it's almost always they can identify where it came from.
What's the most surprising thing that you've seen with COVID, with situations or with parents or with kids, or what's kind of surprised you all the most?
I would say really looking back on COVID and the beginning of this, think what it's done to us as a society, not so much in a medical sense, but when we were all home from work and we were just that unit family at home, or unit, whoever your close ones were, and that you really had that time to really look at, being grateful for the things that you have, and doing the self-care that we all need, like sleep and trying to eat a little healthier, cook a little more, things like that. So I think in history, when we look back at this time, we're really going to look at this as when we actually paused and really reflected on our lives and reflected on what's important and what's not so important. But it's also going to be a time of, people look back on with a lot of grief. A lot of people have lost loved ones, and a lot of people have lost jobs, and a lot of anxiety, and then that's coupled with the whole medical, part of it. But I think really as a society, it's really changed a lot of the way, we live.
Yeah.
Any other? Go ahead, Dr. Fernandez.
Yeah, just to echo on that, I think with that pause, it's given us a chance to really stop and notice. I find that parents are able to kind of notice things about their children that maybe otherwise they would have overlooked. They're catching symptoms far quicker. They're calling me after seeing concerning symptoms after 2 weeks rather than 6 months having gone by about their children's emotional well-being. So that for me, I think has been, really just a huge benefit, that parents are really noticing their kids since they're spending more time with them and accessing services maybe more quickly than they would have otherwise. The other thing, while not surprising, but just always relieving, is to see resiliency, at its best. Children in particular, the way these kids have been able to adjust, I see it with my own children and my patients with the Zoom calls 8 hours a day. I am blown away at how they're able to thrive in the midst of such a chaotic, confusing, scary time.
Well, kids often adjust a lot better than adults, that's for sure. And Dr. Mendoza, anything real surprising stand out to you?
Yeah, I was surprised how badly my kids want to get back to school.
Yeah.
No, but really, I was surprised more when, they get, they really adjusted to virtual school pretty well. But when getting back to, my kids are in either full or hybrid, I was surprised how much actually we're looking forward to it.
Okay. I have another question from a viewer. They want to know, how long are you contagious once you get COVID? Typically.
After you have a COVID positive, that you should isolate at home for 10 days, and your symptoms should be resolved, and you shouldn't have fever for at least 24 hours. The CDC has changed that a little bit over time. It used to be 3 days without fever. Now they cut it back to 24 hours without fever.
And what's your policy with contact tracing, as far as if someone does have COVID, do they have to test negative more than one time before they can go back to school? And also, how do you look at these false positives, or how prevalent are those?
Well, that's a great question. One of the things we do is work with a school to see what policy they want to set in place. And right now we're not using a second test and being negative as a requirement, because we know that you can shed the virus for weeks, if not months. So it's a symptom-based. What the CDC has moved to in general is a symptom-based kind of return to school policy. So we don't use a second test. We really go off symptoms. This is something we're doing mostly in the healthcare environment as well. It's a symptom-based policy to go back. So we don't need a second test to go back to be negative. Second test to be negative to go back to school.
And the reason for that is like Dr. Mendoza said, there are just fragments of the virus still left. So it's not contagious virus. This is not a virus that you're going to be transferring on to other people. But what was happening is we have these people that did not have the virus, but they check what they call little nucleotides of the virus when we do the testing. So they were finding these little nucleotides, these little fragments of the virus, and keeping people out of work. And it was really tough on a lot of families. So really the testing-based strategy, we don't recommend. We do recommend a symptoms-based strategy.
It's been tough on everyone. A couple more questions that came in, everyone. Kids at school have their lunch in the classroom with tables 3 feet apart. Wouldn't that pose a risk?
In the classrooms, everyone should be, and these are American Academy of Pediatrics guidelines, everyone should be facing the same direction. So that if anybody does cough or anything like that, that everything goes in one direction. We shouldn't have kids facing each other. We do recommend anytime that it's in an enclosed space and someone doesn't have their mask on, that we do have the 6 feet. I know at some schools we had to be pretty creative. We've used a lot of outdoor spaces. Kids have gone out like having little picnic lunches, things like that. So it is important to talk to your school and let them know that you want to look at being as safe as possible for your children, and especially when they're in an enclosed space without a mask.
Right.
So the 3 feet apart would be a risk.
For having no mask on, yes.
Right, because you're eating. Yeah. So, yeah. What about Disney World? People claim it's safer because they drive from Miami, but isn't it considered a public place? Talking about the mouse. Be careful. The mouse owns everything. But, but seriously, it is public, and boy, everyone touches everything there. So what do you guys think?
Hand washing, masks, social distancing.
A mask. I mean, you can't let up your guard anywhere in public. And anytime you're outdoors, you're way better off than being indoors. So, how you experience any theme park, if you can do that outdoors, it's going to be safer than being indoors at any activity or attraction.
So I'm sorry, I cut you off. Go ahead, Dr. Mendoza.
That's it.
Would you all take your loved ones to a theme park at this time? We'll start with Dr. Fernandez, because we know that helps the mental health, but we know there's a risk. Would you take your family there? What do you think?
Not just yet. I think that there's a lot of places where I don't think, I think that there's power in the subtle ways of connecting. I don't know that we have to go so big. It's, we've done virtual roller coasters here at home. We have done beach vacations, that kind of thing. But I think if the intention is to create connection and make memories and allow for a breath of fresh air, we can do that in lots of places. I know Disney markets itself as being the happiest place on earth, but there's lots of those. It's not just at Disney.
Good point. How were the roller coasters virtually? Pretty good?
My kids thought it was the coolest thing ever. They loved it.
Hey,
No lying.
sounds good. Sounds good. I believe it. What about you all, Dr. DeChurch? Would you do a theme park trip right now with, I know you say wash the hands, mask, social distance. Would you do it?
I think that there is something to be said for people to have independence and make their choices. But I think if you do make a choice to go to a theme park, that you do need to do it in a safe manner and to really be cognizant of everything you're doing and assume that everything you're touching or when you're close to people, that all those people have COVID. That's pretty much what I do. I just assume everybody has COVID when I walk around. I assume I get it from anybody. So I think that's the main thing. I myself took my daughter to Fairchild Gardens. We walked around the gardens. It's a nice open area. It's not crowded. I haven't really looked too much into the theme parks as far as how many people they're letting in, but I would assume that a lot of those things are being looked at by reputable places like Disney. But it's not my top choice, but I respect people's decisions as long as they're going to do it safely.
Dr. Mendoza, is it a yes or no?
Well, it kind of depends. I haven't looked too closely to what mitigation strategies the parks are doing and what activities and attractions are open. So it's something that certainly they want to, our kids want it in their near future. So we're going to have to reevaluate when we get closer to that time. And luckily in this part of the country, in Florida, we're getting into our good weather period, and so we can spend time outdoors. But I think if there's options to be outdoors mostly, we have, too many other good things around Miami and South Florida right now to be thinking about theme parks. But I think it'll be in our future at some point.
Yeah, we got to remember we're in South Florida. We got it a lot better than a lot of the rest of the world. Let's end it because we're past our hour actually, but I did want to just talk a little bit about, staying in your bubble. You hear a lot of like, oh, I stay in my bubble of people here, my bubble of people here, but it seems these bubbles really start to kind of overlap and you got all these bubbles overlapping. How do you handle that and how do you approach it and how do you talk about it and how does it work with contact tracing? We can start there with that, Dr. Mendoza.
Well, I think, depending how much your bubbles will overlap. I mean, is it going out to an outdoor activity with another family that may or may not be, a different school? I mean, is it Is it having, close, are you going to vacation with another family in the same, rental house? I know, there's certainly the opportunity now, the testing is available to have different bubbles tested if you're going to spend a lot of time together, whether it's with your grandparents or visiting from north for Thanksgiving. So I think it depends how close proximity, how long. We know it's a time, how long you're in the same enclosed space, and distance, and also kind of protection. So I think when those bubbles, when you evaluate what activity or how that bubble is going to interact, are you going to be outside? Are you going to be closer than 6 feet? Are you going to be wearing masks? If all those are yeses, you're probably less likely to have to, really have any other mitigation strategies. If there's no, or if it's unavoidable that you're going to have to be in close proximity, you may want to think about, there's a certain risk you're going to have to take, or, there's maybe testing ahead of time before you interact.
Okay. Dr. DeChurch, the overlapping bubbles?
Yeah, I would say be careful with overlapping bubbles, especially if you have anybody that's high risk. I know in our family, my mother-in-law and my mother are at my house almost every day. So whenever we do interact with anyone else, we're very careful with them. So just keep those things in mind, protect those that are vulnerable. I would say I wouldn't have a bubble that's more than 10 to 12 people. I'd be pretty much your household and maybe one other group of friends, and make sure that they're people that are doing the same kind of things you are. Make sure that they are wearing their masks when they're around others, that they are social distancing, that they are, staying up with hygiene, and be a good example for your children. Children look to adults, whether you're a teacher, and whether you're a parent. I think it's very important that you set the example. If you're not going to wear your mask, your kids aren't going to wear their masks. Right. And if you're not going to wear it properly, your kids aren't going to wear it properly. So I think those are really important things whenever you're going to be interacting with other people. But I do think, as humans, we need interaction. So I think we need to try to do it as safely as possible and really protect those high-risk, vulnerable people.
And Dr. Fernandez, come in right there with, we need that human interaction. It's imperative for our mental state of mind. What do you think?
Yeah, absolutely. And children learn a whole lot through play. So again, I go back to a previous comment of just being creative. There's ways, maybe toss around a Frisbee where we can maintain those 6 feet distance, maybe, make sure hands are washed, no touching of the face. I think being safe doesn't mean that we have to opt out of working on other areas of development, right? We still have to attend to our emotional well-being, our social development, and connection. Being physically distant doesn't really mean that we have to be socially apart. So certainly continue being safe, but also recognizing that children need to play.
Absolutely. We're over a little bit on our time, you guys. I'm going to let you all, if there are any ending thoughts. We covered a lot of ground. You've done a great job, very informative. We've had a lot of great questions also. So a big thank you to everybody for joining us. Any kind of final thoughts or anything we didn't get to that you think is important to mention?
My final thoughts are, this is all about school and getting back to school and the kids going back to school. Parents need to be engaged with their school, with their administrators, with their PTAs. Ask the questions that you heard. If you have questions about tonight, or what's happening with the protocols, what's happening at school, what are you guys doing to keep the kids safe, the parents safe, and be engaged.
Dr. DeChurch?
Say, remember the 3 things that you can do for prevention. Make sure that you have the proper mask wearing. Make sure that you're keeping good hand hygiene, not touching your eyes, nose, or mouth with unclean hands, and making sure that you do socially distance.
And Dr. Fernandez, leave us with one good mental state of mind thought.
Attend to the whole child, communicate with your kids, be honest, ask open-ended questions, and take a breath. Just take a breath when it feels like it's getting too hard. Know that we're all in this together. Reach out for support when you need.
Great. Just don't take the breath near somebody who possibly has COVID, because then that would just ruin the whole thing. Okay. Hey, thank you so much. What a wonderful panel we've had tonight. And thank you to everybody for joining us here. This was our official Scrivas Town Hall. Before we end the webinar, we do want to direct everyone to the screen. Take a look. It includes the contact information for all of our speakers who were here tonight. We had a great list of them, and we also have a list of, we have the email address. If you'd like to get a link of our webinar, which has been recorded, just send an email to Scrivas. Oh, there we go. Scrivas@zapwater.com. Scrivas@zapwater.com. Hey, it was a pleasure talking to all of you. I know I learned a lot, and a pleasure being your host tonight. I'm Cynthia Demas. Thank you so much for joining, everybody. Have a great night. Be safe. Wear your mask. Wash your hands and socially distant. Good night.
Night.
Right.
Thank you.